Hi everyone!
As always, it's Rebecca Samuel.
I'm Kavya Shinoy,
And I'm Adar Rao.
and this is the
The
Iron
Iron
Messengers
Messengers.
podcast.
And today we have a very special guest, a hematology specialist, Kelley, and she's here to give us so much insight about anemia and the effects and causes of it.
So let's get started.
Okay, we'll start off with our first question. So, what exactly is anemia and what causes it?
Okay, so anemia means like your body doesn't have enough healthy red cells or hemoglobin to carry oxygen effectively. Most commonly in teens in your age group is because of low iron, but other causes can be like blood loss or poor nutrition or chronic illnesses, some genetic conditions. But that's kind of generally what we talk about anemia, what it is.
Okay, that's exactly what we heard from our research too. So it's really nice that you gave us like a proper like definition of anemia because when we were doing our own asking around our school, we realized that a lot of people didn't know what anemia was, and so I
Hmm.
think a lot of people needed to be educated about that.
Yeah, so I know that you talked about like teenagers going through kind of like the iron aspect of anemia, but really like how common is anemia? And I'd say like kind of like in a broad scale if possible and maybe like zoned in on like specific types like maybe iron deficiencies, what you were talking about, I think. Especially in, teenagers and young adults like you were talking about.
Yeah, so like I don't have like the statistics off the top of my head exactly, but anemia in general is like super common. I think it's like 1 in 5 teens is affected by anemia and specifically iron deficiency anemia. Around 30% of teen girls are iron deficient. And we think this is probably underreported because people are not seeking care necessarily if they're having symptoms because they're not aware of those symptoms. And right now, the American Academy of Pediatrics does not require routine screening for anemia for teens or even teen girls.
Wow. Okay. Yeah. I definitely like I feel like a lot of people in our community are definitely like very like Rebecca said kind of uninformed definitely 'cause I think a lot of people don't know exactly how many people struggle with anemia. I think they like hear it on
Mhm.
the news. They're like, "Oh, they're just iron deficient." They don't realize that they're really struggling. So I think that's a really good insight about that.
Yeah.
I know that you've brought up iron deficiency anemia quite a lot of times. So, what are the most common types of anemia that you see in your patients?
Are you saying outside of iron deficiency?
Yeah, outside of iron deficiency anemia.
So when we think about anemia, we sort of group it into like three buckets. Either your bone marrow isn't producing enough red cells, or your body is breaking down the red cells for some reason, or you have ongoing losses. And in the setting of sort of like, or nutritional deficiencies even, but in the setting of like ongoing losses and nutritional deficiencies, often we think of iron deficiency or folate deficiency, or B12 are kind of like the three big nutritional ones. When we think of like hemolytic anemias, those are less common, but probably this, I would say, like the second most common cause that we see. And then you also have like anemia of chronic disease is also probably right up there. And anemia of chronic disease, what happens is you can actually have with your iron, so basically your receptors for iron stores kind of shut down and you don't absorb iron and you can develop iron deficiency that way, or your bone marrow just doesn't produce enough red cells because it's under stress. So we see that in like patients that have like IBD or like irritable bowel disease is also very common.
So, if the bone marrow is under stress, that can cause anemia.
Yes, so you just don't have enough production of red cells, but there's also like genetic conditions in which you just have bone marrow failure and you don't produce enough red cells at all.
Okay, okay.
So, based on all of like the different types of anemia, like how serious can anemia become if it's not treated correctly?
It depends a little bit on the patient in the severity. So certainly it can become severe in many conditions, and if it is severe, it can interfere with growth and development long term. You can get symptoms like, difficulty concentrating in school, difficulty with growth, difficulty with overall energy, Long-standing anemia can cause actually heart issues. You can get like a murmur, a heart murmur from it because your body's working harder. And so it can impact sleep. It can really impact all parts of your life because your red cells is what carries your oxygen to all the tissues in your body. So it certainly can become pretty serious and serious enough that some people actually require like blood transfusions.
Mm.
Yeah. The next one is what symptoms should someone look for if they think they might have anemia?
Yeah, so symptoms of anemia are like fatigue, pale skin, shortness of breath, dizziness with standing, feeling cold, exercise intolerance, rapid heart rate. Headaches are pretty common too. And just sort of like feeling drained and like fatigued. Taking more naps can be a sign too.
Yeah, so do these like
Yeah.
symptoms kind of sometimes overlap with maybe like other diseases and stuff? So like people kind of misconstrue that. Is that what?
Yeah. Yeah, that's a great question. Yeah, some of these are, what we sort of call like non-specific symptoms and can certainly be a little bit hard to diagnose if, because they can be associated with other things as well.
Got it.
But sort of together, all of those symptoms are pretty classic for anemia.
Got it. Okay, thank you.
As to not confuse anemia with other diseases, how do doctors usually test for anemia?
So just a blood sample, what we call like a CBC or a complete blood count, and on that you have your hemoglobin, and that's or hematocrit and your red cells, and that together sort of tells us whether or not you're anemic. And then once the other thing we look at that too is like something called the NCV or the size of your red cell. And so that size also helps us to decide what kind of anemia we think you might have. Small red cells are pretty classic for iron deficiency, or something called beta thalassemia or alpha thalassemia, which is an actual defect in the hemoglobin protein. Normal size cells with anemia is more consistent with like a hemolysis or a breakdown in the red cell, or an anemia associated with chronic disease, or like an underproduction of red cells. And then a macrocytic or a large red cell is associated with like a folate deficiency or B12 deficiency.
I'm so sorry about that.
That's okay.
Hear that. Yeah. So moving on, we just want to talk, we don't want to focus, I guess what I wanted to say is that like there's a lot of focus on like iron deficiency anemia. A lot of people know about iron deficiency anemia, but there's so many
Mhm.
other types of anemia, and we also want to highlight that through our campaign because we don't want
Yeah.
to be talking about iron deficiency, but we want to talk about like what is the difference between iron deficiency anemia and like the other types, or like what are the other types?
Yeah, so I talked about that a little bit. So kind of we talked about like those three buckets of sort of what we think of anemia. And then you sort of have subclasses inside of each of those sort of categories of anemia. So something like a bone marrow failure disorder would be like an aplastic anemia, and that's a pretty severe condition that actually requires like a bone marrow transplant. You have like in your anemia of chronic disease is also really common because any other sort of like underlying disease that a patient has chronically, like an autoimmune disease, can cause kind of like the secondary anemia. And so we see that pretty commonly as well. And then obviously your other nutritional things like folate and B12, although those are less common, I think, in like the US, maybe more common in other places where nutrition is a bigger issue. And I will say, more recently, we've been seeing actually vitamin C deficiency causing anemia, like scurvy. People think of like, ships on the, sailors on the ships, not getting access to like vitamin C, because of our processed foods and people just not consuming fruits and vegetables. So not super common, but just because of our diet overall, we've been seeing that more often.
So
Yeah.
you say that our diet has a really big impact in if we get anemia or not.
Yes, yes. Our food and diet has a huge impact on that, for people who are otherwise healthy. Yeah.
Can other diseases like not relating to anemia, well, initially not relating to anemia, I think like Crohn's, when I was like doing some research, Crohn's
Mhm.
disease, those kinds of things, can they end up causing anemia?
Yeah, so Crohn's is pretty common for a couple of reasons. One, because you have ongoing blood losses with the disease itself, but also because anytime you have inflammation, especially in the duodenum, which is where iron is absorbed, the receptors just shut off and you're just not able to like absorb iron. Really, in any chronic inflammatory state, iron is poorly absorbed. And so actually those patients a lot of times wind up needing like IV iron because they just don't absorb oral iron supplements.
What would you say are the main treatment options for all the different types of anemia?
That's a really hard question to answer because it totally depends on the kind, right? So if you're talking about like, a bone marrow failure production, then some people actually require like chronic blood transfusions or like a transplant in severe cases. If you're talking about anemia of chronic disease and really treating the underlying problem of the chronic disease is really the treatment. If it's something like a hemolytic anemia where the patient's breaking down their own red cells, then it depends on how, like the degree. And so sometimes like steroids or like immunotherapies can be used or supportive care, which would be like blood transfusions. And obviously, if it's like a nutritional deficiency, then correcting the nutritional deficiencies.
Right, right.
Okay, so what foods are best for preventing or helping with anemia?
Um, I mean, really having like a well-rounded diet is going to be obviously most important. Red meats and chicken, your beans, your leafy green vegetables, your root vegetables, eating some of the like the iron fortified foods, like we talked about vitamin C, eating C rich foods, also really important.
Okay.
Yeah.
Um, what daily habits can impact somebody's ability to like have anemia or not have anemia?
So, I mean, eating a balanced diet, obviously. Hydration is always important too. Sleep, recovery, just in general, a healthy lifestyle can help. But if you have anemia that is ongoing and untreated, then, you really have to seek medical care in order to, correct it. No amount of, a lot of times just, diet and exercise and sleeping and all those good things alone aren't going to help.
Yeah. I wanted to go back to the diet question for a second, but are supplements or like
Yeah.
iron pills always necessary or can diet alone fix it? Because I remember for like when I had anemia, like diet changes wouldn't have like helped at that point because like it wouldn't have like increased my iron significantly. So like are there like cases where like supplements or iron pills are like I don't know. Or like I guess it's like can diet just like fully help you like not be anemic anymore?
So it's a little bit dependent. Everything's always a little bit dependent, right? In most cases, if you truly have anemia, then no. If you're so iron deficient that now you don't have enough iron to make new red blood cells, then diet alone is not going to fix that. And it also depends on what the underlying problem is. If it's nutrition related, so like in toddlers, we see it because they love their milk, and calcium actually inhibits iron absorption. So in that case, actually just stopping calcium, like the milk in addition to doing supplements, often corrects the problem. But yeah, in general, no diet alone does not fix the problem.
Are there any myths or conceptions about anemia that you would like to clear up, with experience in that field? Like, is there anything that people often misconstrue that might be helpful to clear up with the general population?
Yeah, I think a couple things. One, I think it's stereotype that anemia only affects girls, like teen girls, and that's not true. It affects teen boys as well. And that it's sort of like no big deal. I'm just sort of tired, and I can just sort of deal with it because anemia really affects your whole body functions, and really all parts of your life. And so it's something that really should be addressed. And I think there's also myths that like iron pills always cause problems, always cause upset stomach and constipation, which are like the common side effects, but there's tons of forms of iron on the market. And for some people that happens, but for everybody, that's not true. And it's a good place to start.
Yeah.
I think it's definitely good to clear up misconceptions like this in the community because when we were interviewing people, they definitely like had a lot of misconceptions about anemia and didn't really understand what it was or who has it or how it's caused. So I think it's definitely really helpful to get that insight from you.
Did you guys get any like specific misconceptions that were kind of
I mean, a lot of
eye-opening?
times, yeah, a lot of times people were just thinking that anemia was lack of iron, like it was only iron deficiency.
Yeah.
And I think that has something to do with the most because most of the people, at least in our community as well, like most of the people have iron deficiency anemia if they do have anemia. Uh,
Yeah.
but they're like they don't know all the other different types of anemia and they don't understand what it actually is. But all the answers we got were just it has something to do with iron.
Got
So
it.
yeah.
Yep.
How can students or young people spread awareness about anemia in their communities or do something to help people who have anemia?
I mean, I think what you guys are doing is great, right? Like just talking about it, getting the facts, sharing on social media. I think that, regular well checks with doctors is really important. We think about it as a community, certainly as babies and toddlers growing, but like even as teens, even if you're feeling well, like those checkups are super important because that's where things are caught. That's where things like anemia are caught because over people that are anemic, especially chronically over time, like their bodies do adjust to a certain extent of sort of living with a lower hemoglobin. And so until they actually get treated, they're like, whoa, like I feel so much better now. And so maybe don't always notice those things if they're happening, if they're subtly happening.
Yeah.
Okay, I just want to end with this one more question.
Yeah.
So I know this question was like a little hard to answer, but is anemia something that has a recovery process, and does this happen for everyone? And like, how does this typically look?
No. So I'm gonna have you repeat that one more time because you froze.
Oh, okay. I know we talked about this question a little bit, but is anemia something that has a recovery process?
It does for some people. Yes. Obviously we keep going back to iron deficiency because it's the most common. So it is certainly the most commonly talked about, and that certainly does. But with with that kind of anemia or any sort of like anemia of chronic disease, if you can correct the underlying problem, then you can recover from anemia and it can get better. And for most people, that's the case. There is treatments that can improve anemia for most people. It's sort of the people that are born with a congenital reason or a genetic reason for having anemia, like a defect in like their beta globin or their alpha globin, or other kinds of like sickle cell disease. Those kinds of things are, for those people, it's really just about supportive care and optimizing them, to the best of our ability, but they will live with anemia lifelong.
Got it.
That's
Okay.
unfortunate.
Yeah. Thank you so much. I think that's kind of all the time that we have for this podcast. Thank you so much for joining us. We really appreciate it. We definitely learned
Yeah.
a lot.
Yeah,
And I
means a
think,
lot.
yeah.
Is there anything you'd like to like tell everybody before you leave?
I think that no, I think we mostly covered everything. I think it's just I'll reiterate that it's really important to like get your well checks and check up and tell your parents, right? Like I had I've had patients that there's something called pica that happens when you're iron deficient, where you eat things that are like non-nutritional. And sometimes those things are like paper or it's been baking soda or very like odd things, and people are embarrassed. And so they don't talk about it and they don't tell their parents and they live like that. So I think it's important what you guys are doing, like normalizing the conversation so people can seek help and realize that it's just part of being anemic.
All right, thank
Thank you
you.
so